One of the Gauteng Health Department's top bosses at the time of the deadly marathon project says he played no active part in the planning of the transfer of mental health care patients from Life Esidimeni. Dr. Richard Lebete says he was also not involved in the vetting of the NGOs.
Were you at all involved in the decanting of the mental health care users from Life Esidimeni to the NGOs or the hospitals or home, whatever the case might be?
No, I wasn't involved in the decanting there.
Although you were a member of this project team, did you play any active role in the planning of this whole project? And if so, which role did you play?
No, I didn't play a major active role, in that most of the time I was unavailable. In fact, I didn't attend the project team meetings.
He told the court that he visited one of the NGOs, Takalani, prior to some of the patients moving there, and that there were complaints that the NGOs wouldn't have the same level of care.
And the concern was that NGOs would not have the same level of professional support to ensure that mental health care users were well looked after and received optimal care.
Yeah, separating the questions, the last one, it's true that NGOs wouldn't have that level of care or have the type of professionals on site. But at the same time, the earlier part that you mentioned, I would have expected that Life Esidimeni, being a rehabilitation center, would have those type of people who would be taking care of patients.
Thank you, Doctor. Another concern was that some of the family conditions were not suitable for mental health care users on the one hand, or the family could not or would not accept a mental health care user in the home environment. Are you aware of complaints or concerns of that nature?
I'm not aware of them, but I would understand. I mean, it's logical that with such a big number of people that are involved, there would be families that would not be able to take their loved ones back.
And that some of the NGOs raised concerns that they were not suitable to look after the patients.
I want to refer you specifically to 40.4, which reads, some NGOs voiced their concern that they were not capacitated to look after the Life Esidimeni patients, but the Gauteng Department of Health officials dismissed their concerns. Were you present at that meeting?
No, I don't remember being present in that meeting, sir.
Were you made aware at any stage that some NGOs had voiced concern that they were not capacitated to look after the Life Esidimeni patients?
No, I wasn't made aware.
The inquest continues. Crisalda Lewis, SABC News in Johannesburg.